All right, so good morning, everybody. For those that joined, I think we've got about 100 people who logged in. So thank you for all who joined us this morning. I'm Brian Hurley. I'm one of the co-project investigators on TRDRP-funded project integrating smoking cessation services into community clinics. I'm joined here by Dr. Hinkman, who's the program officer for TRDRP, and by Norma Matumbe, who's a community engagement specialist with the project. I'll ask Dr. Hinkman and Norma to introduce themselves in a moment, but just so we all know, there are no disclosures of commercial support for today's activity, and here's the objectives for the day. We also have an agenda with 2 breaks. So we have a break planned at 10:10, and we have an additional break planned at noon for lunch. And tobacco use is a leading cause of preventable death worldwide. Cigarette smoke is a major risk factor for cardiovascular disease, and the prevalence of smoking among people below the poverty level is over 30%. So we think of tobacco use and tobacco use disorder as a health disparity. There's just under 1 million adults in LA County that still smoke. 1 of every 7 deaths is caused by cigarette smoking, and cigarette smoking and tobacco use products cost more than $4 billion per year in direct and indirect costs. So with that, Dr. Hinkman, thank you so much for joining us this morning as part of our Community Smoking Cessation Dissemination Day. Did you want to introduce yourself and say hello to the group we've been able to assemble here this morning?
Sure. Thank you, Dr. Hurley, and good morning. Welcome, everyone. Very pleased to be able to join you for the day of exciting programs around smoking cessation, and in particular for our populations who have Medi-Cal or lower income. And this is a community practice-based research implementation science award for TRDRP. This was an initiative we launched some years back. And really the focus is around how do we create sustainable systems change around smoking cessation and culturally sensitive tobacco treatments for people who are lower income, with the main emphasis on our Medi-Cal population. As folks are out there dealing with the public and helping them through the COVID-19 pandemic, I really do appreciate you joining these series of presentations and being part of this training. As some folks might be hearing on the ground, there are now people who are really rethinking their tobacco use given the impact of COVID on the lung environment. And I think that this is a key opportunity to really, at least inform, educate people so that hopefully they make decisions and choices that really help them have the best chance of preventing transmission or anything severe from that disease. So I know we won't be talking about COVID, but it does play a role. Just wanted to, let folks know that at TRDRP, we fund research in this area statewide, not just smoking cessation, but understanding the social determinants of tobacco use. And I'll end there and turn it over to Norma. Thank you.
Good morning, and welcome. Thank you all so much for joining us. I'm really excited. We've got over 120 people on already. We had about 240 who registered all over the state of California. We even had some folks from Philly and Chicago and San Diego and San Francisco area, UC Davis area. So thank you all. I'm excited about today. And I just like to help set the stage for us to be thinking about all the information that we'll receive today and what you will do with it when you leave. I'm the community engagement specialist for the Smoking Cessation Project that we'll be discussing today. I've spent most of my life and career building and helping to run nonprofit and healthcare organizations in Los Angeles and similar communities. By similar, I mean communities where health disparities abound. As you all know, smoking has been shown to have a direct causal or significantly exacerbating relationship to conditions such as cardiovascular disease, COPD, asthma, emphysema, and diabetes. Moreover, research shows that smoking can be detrimental to all systems of the body. I saved the cancers, specifically lung cancer, for last because I wanted to put 2 of my many faces on the list of statistics for the wretched health conditions and mortality that can be related directly to smoking. You see, my dad, who was always my biggest cheerleader and hero, died from lung cancer 12 years ago. In 6 months, I watched him go from a robust 185-pound, fun-loving grandpa to 95 pounds and too weak to stand on his own. He covered his mirror because he couldn't stand to see his own reflection. To emphasize the addictive quality of nicotine, he had 3 heart attacks before he quit smoking. By then, unbeknownst to us all, the damage had already occurred. Also, one of my dearest friends since 7th grade that I usually talk about during this segment waged a battle with lung cancer for nearly 6 years, and she died 3 weeks ago. Both of them smoked and had the hardest time quitting. My work with the Smoking Cessation Project as a community engagement specialist is personal. I want to help see that others do not have to watch family and friends fall ill, suffer, and die from smoking-related illnesses as I've done. The best plan is to prevent ever starting to smoke. The second best plan is to intervene as soon as possible. I believe that embedding smoking cessation services into medical and mental health clinics is moving Los Angeles County in the right direction. On a brighter note, within the last 3 days, I've learned that another dear friend made a commitment to change her smoking behavior and texted me that she had not had a cigarette for 20 hours. And that's a big deal when you're a heavy smoker. And another young man that I had the privilege of becoming acquainted with while working on this project also made a decision to stop vaping. This gives me hope that my work is not in vain. I'm proud to be a part of this team, and I look forward to better outcomes for patients struggling to rid themselves of this nasty habit. Again, welcome.
Thank you. Thank you so much, Dr. Hickman, and thank you so much, Norma. Norma, I very much appreciate, as part of our community symposium, it's easy to look at numbers and statistics and forget the human cost and the human toll. So I just want to express my gratitude. Thank you so much for, we can talk about the economic impacts and we can talk about the prevalence and we can talk about the numbers, but the reality is that these are people with lives, and this is real human suffering that is tangible, and these are years lost for people. And so I appreciate you reminding us of that. I think that's
sure. And
that's important.
I think Dr. Friedman wanted to say something.
So for those that haven't met him, Dr. Friedman's the co-primary investigator of the Integrating Smoking Cessation Services into Community Clinics Project. Dr. Friedman, what would you like to share?
Good morning, everybody. Thank you for joining us today. I'm really proud to see that we have over 120 people already and listening, and hopefully we'll get some more later in the day. As Brian and Norma said, smoking cessation is a crucial issue for our society. I don't have a family member that passed away from it, but certainly I know people that have passed away, and I'm really touched by Norma's story about her father and her friend. So we're all into it for the same end game, is to end smoking, try to reduce it among people. In the meantime, and I thank Norval for giving us the funding and TRDP for the funding to do our important research. And it should be a great day. I'll touch base again with people at the end of the day, see how everybody liked it, but thanks everybody.
So Norma, are you good to walk us through some of the CEU mechanics and some of the housekeeping for the day?
I am, and Luce is my backup if I miss something. So I should share?
What I'll do is I'll go ahead and advance for you if that's okay.
Okay, cool. That's great. For those of you who are interested in getting continuing education hours, all the in-depth information was on the registration flyer, and these are the disciplines and licenses that this symposium will support for 4.5 hours of continuing education credit. And I think I'm supposed to read this verbatim. UCLA ISAP is approved by the California Association of Marriage and Family Therapists to sponsor continuing education for LMFTs, LCSWs, LPCCs, and/or LEPs. UCLA ISAP maintains responsibility for this program, course, and its content. Course meets the qualifications of 4.5 hours of continuing education credit for LMFTs, LCSWs, LPCCs, and LEPs, as required by the California Board of Behavioral Health Sciences. UCLA is also an approved provider of continuing education for RADTs, KDACs, and all these letters that you see on your screen before you. CE credit will be awarded at the conclusion of the symposium. Partial credit will not be available for those who arrive late, leave early, or do not attend fully. And you'll be getting a code. I think that's coming up next. This is the code for you to use when you do your evaluations at the end, and there'll be more discussion about that at the end of the symposium, exactly how you get your CEUs and how to click on to do the GIPRA and any post evaluation questions that we have.
And Norma and Luz, Laura asked the question, if somebody's not getting CEU credit, is it possible to get a attendance certificate? Would you tell that person to just follow the same GIPRA process, or is there a separate process for people that aren't doing the CE credits?
No, right at the end of the symposium, a link will show on the screen, and you can click on that link. That's the GIPRA. Everyone needs to do the GIPRA if you want to have a certificate. And even if you don't want a certificate, we ask that you do the GIPRA, because that's the information that goes back to the folks that fund ISAP to provide these CEs for everyone.
So everyone gets to do the GIPRA, regardless of whether you want a training certificate or CE credit. And certainly if you want a training certificate, the way you do it is by following the same CE process will then get you an attendance certificate.
Right, but all you have to do is the GIPRA. You don't have to do the ones after that.
Cool. All you need is the GIPRA. Thank you.
Right.
All right. And you want to talk about the GIPRA?
Oh, we're going to do that at the end because it's a lot to remember.
All right. We'll do that at the end.
Yeah.
Sounds good.
And this lecture will be available. It's being recorded and it will be on this website, and we'll make this information available to you. If you can't take a screenshot right now, we'll pop this up at the end again.
And then Norma, the next slide is discussing your experience. And I'm wondering, should we skip that slide and go right into, or is there more you wanted to add?
No, this is good. We can go ahead. You can finish.
All right.
Okay.
So should we go to an overview of the project?
All righty then.
All right. So thanks to Dr. Hickman for joining us this morning. Your leadership as our project officer has meant a lot to us, and particularly during the coronavirus pandemic, and with all the changes that we're faced with making. Thank you so much for keeping our project going and functional, and so we just want to say with much gratitude, and thanks of course to Norma for being in many ways the conscience of our project. You know, making sure that we're this project is really a community project. And so thank you for making sure that we always keep the community in mind. So thank you to both. And of course, thank you to Dr. Friedman for being the inspiration, the person that started this entire process to begin with. So thank you, Dr. Friedman. So with that.